looks like we have a bit over 700 people, a couple more trickling in yet. We'll look to get started here with the tentative agreement overview. I believe I'm set to turn it over to Kristin, who's going to walk kind of through the PowerPoint, and then we will get through the bulk of the PowerPoint. We'll ask folks to hold questions until the end, so we'll kind of get through the presentation, and then we'll have time for questions on the back end of things. So folks, hang tight as we kind of talk through that. Kristin, all you.
Okay, can you guys hear me? We good? I can't see anybody,
Yep.
so you say yes.
Yes.
Thank you. Okay. Okay, so we have a TA, so we're going to walk through that. All right, overview. So this new TA for 2023 to 2025, it reflects the work of our bargaining team, the substantial engagement from our membership, and the extraordinary services we all do every day. On the screen, you'll see a picture of all of us. It was a really hardworking group, and they did a fantastic job. So what did we get? Some gains. So we got historic wage increases, the highest across the board since, I believe, 1989. It's a contract that includes a flexible workplace and affordable quality healthcare with significant benefits at nominal cost increases. Members in the Correctional Employees Retirement Plan, otherwise known as CERP, will now have healthcare retirement parity with CERP members in other bargaining units. We also got gains in the areas of temporary and classified, meal reimbursement, length of service credit, and some more. So every bargaining round, we fight back some of MMB's proposals. This round, we did fight back lower wage increases below those that we have currently. MMB started at 2% and 1.5%. They wanted to sunset CERP. They wanted to add removal of step increases as a discipline. They wanted to eliminate bumping and layoff options. They wanted to restrict our participation in new employee orientation to 10 minutes. So they wanted to define what reasonable time meant, and they thought that meant 10 minutes. And they wanted to eliminate benefits for intermittent employees, such as sick leave and vacation. Those are not in the TA. We did fight those back. So just a little bit about the negotiations process. So we first got together as a negotiations team in July of last year. So we've been doing this for a year. We started by sending out a survey, and we held listening sessions. Each team member held listening sessions to get proposals from you all. During that time, we were doing planning. So we met quite often through the winter and spring. We planned, we wrote, we decided on a strategy. In parallel to the main team working, there's also a healthcare negotiations team that is called the Healthcare Coalition. That is all of the bargaining units under CGIP. They bargain separately from main tables to bargain the healthcare changes. So you guys all know this. Our strategy came out. We came with less. We've never done that before. This round, we came with 9 contract proposals listed here. We opened bargaining on April 11th. The governor did come to that opening bargaining date. He heard the negotiators tell the stories, the personal stories, and our 9 proposals. I think there were 4 bargaining rounds before MMB called for mediation. That is normal. That has been a normal process for them to call for mediation. During this time, we developed texting campaigns. We put social media posts up, video updates, website stories, and hosted other town halls like this one. So that all culminated in Push Week, where hundreds of you guys gathered at our bargaining site in Arden Hills to show support for us and the contract. And alongside that, members at individual agencies were holding actions. The one that comes to mind right away is the one at Region 9 did, the sidewalk chalk action, which was awesome. That was posted on social media. It was really cool. And then finally, at the end of push week, we did reach a tentative agreement with MMB. The team did vote to refer the TA to the board, and the board voted to refer the TA to members to vote. So, which means both bodies recommend approving this TA. So what is the approval process? So you have to be a member to vote on the tentative agreement. If you are a non-member, you have to join by the end of the day, 11:59 on August 4th in order to vote. Voting will happen August 11th through the 17th, and the results of that vote will be posted, announced on August 18th, the day after. So what happens either way? If members vote to approve the TA, it'll be ratified and automatically implemented. This last legislative session, we got rid of the legislative involvement in this. So our TA no longer has to go to the subcommittee on employee relations to be approved, which is awesome. We took the legislature out of this process. If members vote down the TA, that means it authorizes a strike and empowers the board to set a strike date. That also means that the negotiations team starts from scratch. We start from our original proposals and start the bargaining process again. A lot of members took action this negotiations round, which was fantastic. It's the most engagement I've seen, and this is my second round. We had over 7,000 members sign our petition, our platform. We had more than a dozen agencies hold individual actions. We had hundreds of members join their local contract action team. It's the highest engagement in contract action teams this round. More than 1,000 letters were mailed to the commissioners, to each individual agency commissioners, MMB, labor relations director, and the governor. A lot of people did a lot of things this round, which is awesome. So on the screen, you're going to see some pictures of actions. This PowerPoint is on our TA toolkit on the website if you want to look at these pictures more in depth. So getting into the TA. So what did we get for across the boards? We got 5.5% in the first year in fiscal year 24 and 4.5% in fiscal year 25. So that would be retroactive to July 1st, 2023, if the contract is approved by the membership. A quick note that fiscal year 25 builds on fiscal year 24, so you get 4.5% on top of the 5.5% you get this year. If the TA is approved in August, it'll be retro to July 1st, as I said, and that pay would be expected about 4 to 6 weeks after the contract is approved. So a note about healthcare premiums. There was no increase to our share of healthcare premiums. So the overall cost of premiums, which CGIP currently determines on their own, that is not bargained. So the overall cost of premiums is not bargained. That goes up, that's going to go up by 2.5% for both state and the members of CGIP. A 2.5% increase on healthcare costs is not based on your wages, it's based on a smaller healthcare premium amount, which means for those of you with individual coverage, your increase will equate to an additional 96 cents per month. And for those with family coverage, the increase will equate to an additional $6.56 per month. On the screen, you're just going to see what the costs are going to be. So we also have a 2.5% estimated increase in premium for 2025. So right now it's $38.50 for single. In 2025, that would be $40.44 for family, $262.66. By 2025, that would be $275.95. It's about a $7 increase for both of the years per month. So just to show you how that all works, we did an example. So the wage increase we did based on a $30 hourly wage. By 2025 with a step, that person would be making $35.46 per hour, which culminates in a monthly salary increase of $391.20. as opposed to a premium increase. You'll see the single and the family that I just talked about in the previous slide. That equates to a monthly premium increase of $1.94 over the 2 years per month. For family, that equates to $13.29 over the 2 years. So you'll see on this, it's not a one-to-one, it's not an apples to apples as far as percentage for across the boards versus percentage increase on a healthcare premium. So healthcare top lines, what did we get for healthcare? There were no increases to our out-of-pocket costs. One of the biggest win, I think, that we got through CGIP bargaining was the mental health and well-being reduction in copay. So beginning at the beginning of next year, 2024, mental health care visits will have no copay, and you will have no deductible for those of you in tier 1 and tier 2 for mental health care visits. For those in 3 and 4, tiers 3 and 4, the copay will be $50 and $70, which is a reduction of $20 in copay for mental health services. The deductible does still apply for those in tiers 3 and 4. I think the data says there are about 94% of folks in tier 1 and tier 2 clinics. So the vast majority of our members will not see a copay at all. It'll be free for mental health care visits. Other healthcare top lines, another big change to the health plan this time is an out of service area care expansion. So currently we have a point of service program for those that for residents outside of the coverage area. So our coverage area is Minnesota and the bordering counties around Minnesota. That's going to be changed. Now you will get all services outside of the service area at a different tier. It's a tier 3 with a separate deductible, but you'll be able to get the care, whatever services you need. So currently, if you leave the service area, you only have access to an urgent care or ER services if you leave the service area. With this, you would get whatever service you need at a tier 3. Fertility services, those were expanded. It includes in vitro fertilization. It's a pilot. It was a pilot now. It would become permanent in the new contract and available through all plan administrators. Currently, it's only available through health partners. The other major change is that credit of $70 that we currently have will be discontinued as of January 1st, 2025. It was done in 2025 because people are currently working towards that credit for 2024, and we don't want those people to lose that. Doing the evaluation during bargaining, only about 20% of the members of Seagate actually get that credit of $70. So that coalition decided that that money could be better used elsewhere instead of the credit of $70. So some dental top lines. So our dental went from the dental annual maximum, it would be going from $2,000 to $2,200. So a $200 increase. The dental premiums will increase by 5%. And again, it's the same as the medical premium. It's a percentage of the smaller premium is not tied to wages. Dependent care premium would go from $41.90 to $44 a month. That's the increase for dental for 2024. Some language that we got. We're going to get into language. So telework. So for telework, you will now be granted a meeting with the employer to discuss changes in telework before those changes are made. So the employer, if you want, must meet with you if they are going to make changes to your telework agreement before those changes are made. That allows you to make arguments and talk about why that's happening before it's done. There's also an appeal process for when you disagree with a telework change determination. For both of those meetings, if you wish to have union representation with you, you can. Before you couldn't, now you can. The other change to teleworking, we have folks that had their permanent office closed. They will now have their mileage covered when they're required to do field work or commute to a newly assigned permanent work location. that is more than 35 miles away from your telework location or the location of the previous permanently closed office. SERP, this was a big win. So for over a decade, we've been kind of fighting this. MATE members in the Corrections Early Retirement Program were had disparity in the way that their healthcare premiums were paid. They will now have their healthcare premiums covered at the same rate as current employees in other bargaining units. So this brings them aligned to all of the other SERP covered employees in other bargaining units. This inclusion could save the eligible members $4,000 a year. We have an expanded definition of family. So the definition of family for purposes of sick leave has been expanded to include, it's actually the language from the Earned Safe and Sick Time law that went into effect this last legislative session. Some of the language includes any other individual related by blood or whose close association with the employee is the equivalent of a family relationship. And other language is and up to one individual annually designated by the employee. So you can basically use sick leave for who you consider family. That language is really awesome. We do have the language up on the TA toolkit if you want to see the language incorporated there. We also did get an expansion of definition of family for bereavement leave. That is not the same as sick leave expansion. So if you want to see the actual language involved in that, that is also in the language we have on the toolkit. We got expanded length of service vacation credit, which is awesome. So for both new hires and current employees, the length of service has been expanded to include self-employment and contracting work. Basically, all of the requirements that were in there previously, like the 4 years, the vacation eligibility, the documentation, that would be now gone. So you could be granted to an amount up to the total years of your previous work experience that is related to your current state position. It's still granted at the discretion of the employer, but the employer also recognizes that this is a huge recruitment and retention tool, and they utilize this program. So this is a big win. You can get up, I mean, just an example, if you have 30 years of previous work experience, you could be granted up to 30 years of that previous work experience for your vacation accrual, which is awesome. We got meal reimbursement increases. So for non-high cost localities, we got an increase of 2, 2, and 3 respectively for breakfast, lunch, and dinner. For high cost localities, we got an increase of 1, 2, and 3 respectively. There was also a change to how we define high cost localities. They will now be defined by the IRS. Instead of, it used to be an appendix at the back of our contract, it's now going to be what the IRS defines as high cost localities. It does exclude Minnesota, and the only high cost locality identified by the IRS was Duluth during certain months. So there actually wasn't a lot, it was just Duluth, and it was during certain times. Student loan reimbursement. So we had a pilot previously that would now be a permanent part of our contract, and it would apply to all agencies. All agencies could opt in to doing this now. The amounts are the same. Granting the reimbursement is still at the discretion of the employer. It's still a program that is that the agency decides to implement, the employer decides to implement. We did fix the documentation provision. So previously there was an interpretation that this was a matching program, meaning they would give you the money and you would use the money they gave you to pay your student loans, instead of the reimbursement program that it was intended to be. We've now cleaned that up. It's now reimbursement. You get paid for student loan payments you have already made. So there was some confusion with that, and that's now clarified in the new the permanent part of the student loan reimbursement in the new contract. Temporary unclassified. So the 21-day notification language would now include notification when an appointment is to end early. It's still when practicable, but appointment ending early was added to that at the discretion of the employer. When a temporary and classified employee's appointment ends early, they got something like the transition leave we currently have in our contract. The employer could give them payroll status for 40 hours of paid leave at their discretion. That would be huge for some people because that could put them into another month of getting a healthcare premium. Also at the employer's discretion, there was a medical leave. There's medical leave language added for temporary and classified employees. So for a TU employee who has exhausted their accrued sick leave, they may take up to 6 months of an unpaid leave for sickness or injury at the employer's discretion, though. So some more wins. All of our pilot projects were extended. So they will now continue into the next contract. And that includes the multilingual pay differential, the phased retirement, and the equity adjustments pilots. We have utilized the pay equity adjustment frequently, so that will continue into the next contract. There has been some talk about the incentive programs. So incentives were a priority for MMB this round. They are now authorized to create incentive programs for recruitment and retention. However, they need to get approval from MMB, and they need to notify us of those programs that are being implemented. So we are going to know what incentive programs are being offered. I know Meet and Confer is actually working on this to keep an eye on it. So there'll be more to come on that. PPL usage, so paid parental leave, will now be available for those that unfortunately go through a tragic situation with a stillbirth or a death of a child. Within the time period they would otherwise be eligible to use PPL. This was at least something to help these people because they are going through a tragedy during this time. So some more. Upon mutual agreement with us, with MAPE, an employee's voluntary separation from the state resolves related grievances unless the grievance directly affects their status upon termination or a claim of vested money, so back wages, accrued vacation, etc. 9 of our agencies bargain specific changes for their agencies through their Meet and Confer, through supplemental agreement bargaining. 9 of those were done. And then technical and clarification changes. We also agreed to numerous technical and clarification changes that do not change the substance of the agreement. And some more. So employees may now request to go from full-time to part-time or part-time to full-time on a temporary basis for up to 12 months. So if you have a life situation that requires you to go to part-time, that'll be easier to do now. The request must be approved by mutual agreement between the employee and the employer. There was a location reassignment update to the contract. Employees may now request in writing if you want to be reassigned to a new location further than 35 miles from your current location, and this no longer creates a vacancy. The best example of this is if somebody lives in St. Paul and they want to move to Duluth. This new language will make it easier to do that. And then we also got, well, also in the new contract is upon a mutual agreement with us, the removal of discipline. So if an employee removes their discipline from their personnel file, that resolves related grievances. So what are the next steps? So currently we're preparing for that vote. Your negotiators should be holding TA overview meetings with you all in your local. I know most of them are done. I think there are a couple left, but that's part of the preparation. Another next step is to join. Again, only dues paying members can vote on the tentative agreement. You can join at our website at mape.org/join-mape. You have to be a dues paying member by August 4th at 11:59 p.m. to be able to vote on the TA. So what happens if members vote to ratify, to approve the TA? The contract is automatically implemented. And you would see your retro pay 4 to 6 weeks after that, after August 18th, if it's approved. So be a member, take action. Solidarity in our numbers mean power as a union. Become again, become a member by August 4th to be able to vote on the contract and build for future contracts. You can join online. If you have any questions about becoming a member, please reach out to any of your local leaders or to a BA, to a business agent in MAPE. Another way you can help out is to take action is to get involved in your local. You can look up at your local at mape.org, find your local. Attend local meetings, run for open positions. Nominations for delegates for the delegate assembly actually just closed. They opened July 5th. They just closed July 19th, but we have them every year. So if you're interested, next year is a great time too. Vote general. So voting on the contract begins August 11th. You'll look for an email for that. You have an individualized link for your vote. Also, the 2024 elections coming up. Please get involved volunteering for that election. Funding for our contract gets voted on in the legislature. So please go out and vote. They set our budgets. They set our agency budgets, which tells us how much money we have for our contract. So now we're going to get into questions. Again, all this information is on the TA toolkit at mape.org.
I think it's helpful if folks raise their hand so we can get a queue of folks in the chat for questions. And then we'll just have folks come off mute and ask their question. Looks like first, thanks for Kristin for walking through all of that. It's a pretty robust, beefy PowerPoint. So thanks for going through that. And then we'll start off with Kathleen Cotter.
So on the slide where you were talking about people that you consider like family, the way I read it was I can use that time for my best friend. And then it said, and also one other person you designate. So there's like, if my best friend's mother died, could I designate that as my one person? Or is that all one? Is that all of a piece?
I think it wouldn't restrict you to either. I think you could, anybody whose close personal relationship you view as family, you are allowed to take sick leave for.
Okay, but then what is the point of the one person annually language?
Yeah, it's weird.
So yeah,
it's from statute, so that's where that comes from.
Basically you get one person per year to designate. That's not defined in the statute.
Gotcha. Okay, thank you.
Yeah.
Scott.
Hello. So the question I have here is with the way negotiations went. So with push week, negotiations couldn't continue after push week. So I'm a little confused because last time MAPE went on strike back in 2001, they were given an offer of 2.5 and for 1 year, and then for both years, excuse me, but they actually went back, negotiated, got one more and got 3.5 for each year. This year, we've had the biggest budget increase ever in state history. And I can't believe that we're just going with such a small percentage. I've had a lot of people who ask me in the department I work with in other areas within minute. A lot of them are frustrated also too with the pay scales because a lot of people have worked here for years, were topped out. So we're not going to get a step increase. We're just going to get if we go with this TA of 5.5 and a 4.5. So a lot of frustrations on this. Is there a way to better describe why we stopped at when we did with the negotiations, or why we didn't continue? Because in 2001, the negotiations went on well past August into September until they went on strike. Now, MAPE was formed in 2001 because of the strike and everything. So I know some people are shaking their heads. I'm taking a look at some of the stuff that was on the MAPE site, when MAPE itself, MAPE, not the previous versions of it. So just curious on that one.
Yeah, so, I can take a stab at that. So I think we can be both disappointed in where the across the boards landed, and we can at the same time we can think that this is a strong contract. I think it's incredible that the expectations of this labor union have changed, and that those expectations have been raised, and along with that comes some disappointment at the same time. Just speaking from the last round, something like 97% of this bargaining unit, the folks that voted on our contract voted to approve an across the board of 2.5 and 2.5. And so from last round to this round, certainly the landscape has changed. And I think expectations were raised to the point as to why the negotiations team accepted the offer that we did. There were certainly folks with high expectations and folks who wanted to walk away from anything below 10 of 10 and 10. That was not an accurate reflection of the aggregate of folks we talked to. All of the regional negotiators did kind of their own work with their region, and we landed with numbers that came about. The rough outcomes were about 5.5 and 5.5, 5 and 5, where folks were looking to really walk away. So with that in mind, we had folks that said, take any offer you can. I cannot afford to strike. We had folks who said they would be comfortable with 2.5 and 2.5. And we also had folks whose expectations were very high and wanted 10 and 10. And what we had to make tough decisions on were based on the incomplete data set of all the folks we had talked to, and to try and come up with an incomplete calculus as to what folks were willing to walk away from the table with, and what folks would be willing to take as an offer. And in that room, it was not a short discussion as to where folks wanted the across the boards to land. There was a ton of data and spreadsheets and expectations. And the long and short of it is, at the end of those long days, we felt that this deal was real substantial money on the table that this bargaining unit had not seen in a really long time. And walking away from that, potentially, furthering a strike motion would be dangerous, because that, based on our data, our input, we felt that wouldn't necessarily be the strongest of positions to be turning down. So wasn't an easy decision. Certainly wasn't fun. And it is true that expectations are high, and with that comes disappointment. I'm hopeful that this round of negotiations has changed the landscape and kind of set a new acceptable low water mark for across the boards. So I hope that's a helpful answer. Let's go Greg Moxness.
Yeah, just as far as strikes go, so I work for Min-State, and I've heard from a very reliable source that the MSCF union has voted to strike. It seems like it's pretty on the down low as far as when you go surfing on the web to, see proof of that. And there's no, there's nothing on their Twitter or anything like that. But, so even if we don't go on strike, that might end up being, a big problem for me. And then just kind of revisit the big question is, why did you promise people, or try to promise people, like 11 and 10 and 10 and 10, and then go solo? Just, if you hadn't said it, then maybe people wouldn't be so,
Yeah, I guess the response is, we wanted folks to have high expectations, and we felt that now was the time to make big change. And ultimately, we had to do, we had to come to a deal where we felt the majority of members were going to be comfortable. Certainly there were folks, like I said, that were way out ahead and wanted double-digit wage increases in both years. But based on all of our information, we did not feel like that was the massive representation of the remainder of this bargaining unit. And we took a deal that was somewhere in the middle. And I think that is just kind of the way negotiations work. we have to start with something that is high, that we think is not offensively high, but is high. And somewhere in the middle, we work down to, we winnow to a spot in the middle that we think is acceptable. So that's just kind of the process of negotiations. And with it, I think, comes some of the disappointment that we talked about. Austin Bell.
Hi, yes. So my question had to do with the mental health copays. So for healthcare in general, I'm tier 2, but I do receive treatment outside of my physician. So I was wondering how that works when you have a private or somebody separate from your health, from your primary healthcare provider.
Like outside of network, is that what you're asking?
Not outside of network. It's in network. It's just like, yeah, I guess I'm just confused. If you have tier 2 and your mental health provider is in network, that means you have no dues, or does it have to be through like mHealth Fairview, for example?
Austin, we don't have a restriction on where you can get the mental health care. Maybe Pete can answer this for me. I don't know if mental health care requires a referral. But if you do all those things, like get a referral and go to a mental health care facility, regardless of where that is, it is covered. As long as it's in network, that is covered. There's no copay and no deductible for that.
Michelle.
Hi, thank you. I guess I'm just having a difficult time considering voting yes on a contract that is essentially a pay cut, given what inflation rates have been the past couple of years. So I guess what I'm wondering is, how can we ever expect to get a contract that keeps up with inflation if we don't push back now, when we have the most pro-labor government that we could ever hope to have in the state and a huge budget surplus?
I would push back a little bit on the most pro-labor administration. These are certainly, Democrats and relatively pro-labor, but far from a progressive wing. As far as keeping up with inflation, I think that's a real concern, and I think that that's where we pushed. Ultimately, it didn't feel like the across the board increase was going to match, the 7-9% inflation. We just didn't feel like that was going to happen based on the actual budget and the money that was on the table. Because the scale of statewide employment is so vast. I think something like a quarter percentage just in the MAPE contract is something equivalent to like $9 million. So with every quarter percentage across the state enterprise, it does have a significant impact on the budget, and the money does have to be set aside and isn't necessarily always earmarked for the existing government enterprise. That doesn't mean it shouldn't be. That doesn't mean it can't be in the future. It means, part of the negotiations is we have to take a measure on what the employer has to give us and our ability to compel them to give it to us. And so that was kind of the balance of power that we had to wrestle with. And ultimately, it's disappointing because we do deserve more. I'm not sure that the dollars and cents will work out to a pay cut for folks. Certainly some things have skyrocketed over the last handful of years. Our hope and sense is that the across the board increase of 10% across 2 years will cover that. Tanya Rolson.
Hello, can you hear me?
Gotcha. Yep.
All right, good. So I'm the chair of the DHS Meet and Confer, and DHS Meet and Confer was involved in the supplemental bargaining with DHS, which resulted in a stalemate because we refused to accept the same incentive and retention language the main table has agreed to in the permanent contract. So I'll be voting a hard no on this contract. That said, I support the troops, even though I'm against the war. So as I explain why I'm voting no, please know that I support the negotiations team, even though I'm against this contract. I know that this job is hard. MAPE is giving away its ability to address equal wages for equal work when it agrees to add to the permanent contract a provision allowing agencies and MMB to develop incentive and retention policies without any negotiations with MAPE. MMB will now only need to give MAPE quote unquote notice. MAPE won't have a say in any of this. This means MMB will have no incentive to work towards a pay scheme where members are paid equal wages for equal work. This contract trades away our future bargaining power for the same COLAs AFSCME got. The other things we got are low cost or no cost items to the state. The DHS Meet and Confer refused to accept this incentive proposal in supplemental negotiations. In all the meetings we've had with members, none of them have said to us, let MMB enable a plan that allows unequal pay for equal work. So my question is, why was this blank check given to MMB? And why were they allowed to create these inequities? Second, how do you propose to get this power back in the future? And then finally, I've gotten questions from members about why they did not receive some kind of text message about the final offer so that you could kind of take in a pulse with regard to where members were at. So thank you so much.
Yeah, thanks for the question, Tanya. I think the reason we ended up agreeing to the incentive program with MMB was because they viewed it as a significant priority, and our team had long discussions about the inequities that incentives without a ton of oversight can create. They viewed it as an extreme priority that would help them hasten emergent situations around covering shifts in 24/7 operations, things around what the next pandemic might look like, and really creating bonuses to incentivize work getting done on short notice that wouldn't be drugged through the MOU process. They viewed that as pretty burdensome. So I think that that's kind of what we were wrestling with. Ultimately, we agreed to that because there is opportunity that it puts real money in our members' pockets, and part of the give and take of the bargaining was us agreeing to that proposal, and we didn't love it, but there is real opportunity for folks to benefit from that. So that was kind of the other side of that. Sarah.
Sorry, can I chime in really quickly? I just want to give notice that there is 11 minutes left in this meeting, so could we all collectively keep it tighter so we're able to address the people that have their hands raised?
Yes, thank you. That seems unlikely given the list of queued up folks, but yes, let's try and keep it short here. Sarah.
Thanks to the negotiations team. My question revolves around the student loan reimbursement. From your discussion earlier, I'm just wondering or wanting to clarify, the employer has the ultimate authority or judgment on whether or not they're going to even offer that, and is it also how much, or is it like a $5,000 reimbursement or nothing?
Hey, Sarah. So it is the discretion of the employer, so that each agency can decide to implement it or not. Some of our agencies already have implemented this. The amounts are laid out in the actual language, and I don't remember that off the top of my head. unfortunately, what the amount is, but the language is on our website. So there are guidelines as all of that. So take a look at the language on our website and you'll see what the guidelines for that program are.
Okay, thank you.
Ray Simonson.
Mine is more of a technical question on voting. We have so many paid members. It's a yes or no vote. How do people who do not vote, do their votes, non-vote count as a no?
No, so it is only the
Only the voting people.
is only the votes cast.
Okay, thank you.
You're welcome. Adil.
Hi. I'm just wondering, what is exactly a step increase? I'm relatively new and I don't understand what a step increase is.
It's a good question. So on your yearly anniversary date, so the start of your classification, provided you have a reasonable review, it's a 3.55% increase typically, which goes across like a 12-step pay scale. So the step increase happens on your classification anniversary date, and it's 3.5% roughly.
Thank you.
Jameis.
Just curious as to what happened to the proposal for adding an extra step in for PTO. I know there was like a proposal for like every at your third year, adding another step in there. Right now it's 5 years before the next step, and I'm a new employee, so it takes me about 5 months to save 1 week of vacation. And I'm just wondering if we're going to continue to work towards that progress.
Yeah, it's a really good question. That proposal ended up getting dropped. As kind of noted, it's just part of the give and take. It was dropped pretty late in the process. The trade-off we saw was that the length of service experience credit would help to solve some of those problems with work-life balance and new folks coming off the street with low accrual rates. Certainly that will not address everybody's situation. But the thought from our team was that the length of service credit and how expansive that is, we removed a lot of the hurdles and a lot of the barriers to getting that approved. And there is no cap to relevant experience being credited. So certainly not a perfect solution. We will continue to bring that, I'm pretty certain, in the future as the accrual topic does always come up. But yeah, as of this round, there was no forward movement on that one.
And I just want to make a note, in case it wasn't clear during the PowerPoint, that if you are a current bargaining unit employee, you can, if the contract is approved, you can go back and request more. You can put in another request.
Yeah, I would encourage everybody who has any relevant experience to submit that to Human Resources.
Yep.
Rachel.
Hi, thank you. My question is specific to like striking and if that would occur. And hopefully this is met without judgment. I support negotiations and striking. I understand powers in the numbers, but I also have to make rent and student loans. So like, please just keep that in mind. So my question is like, if you do support, if you do go on strike and you decide not to work, but then if something happens where like financially you feel like you need to go back to work, can you then go back and then get paid for when you go back? Can you go in and out, or like what if you decide to strike, are you just considered not working for that amount of time until it's done?
Yeah, it's a really good question. The short answer is we would love on a strike that everybody stays out and everybody walks the picket line, because that shortens the strike, makes it a more strong, crippling strike, which helps us to get to a better deal. We understand certainly that not everybody is financially capable of going a week, 2 weeks, 3 weeks, an indefinite period of time without a paycheck. You know, you get paid for when you work. The ask is that when you are on strike, that you are not working, and that would mean you are not getting paid. It is not, there's no sweeping statement as to how that would play out. But that is part of the calculus that this team had to wrestle with when making our decisions. Were the financial situation of our bargaining unit, folks we heard from, and questions like that that are all very material to the decision we had to make.
Question: does the out of area healthcare language include outside of the United States?
No.
I don't believe so.
No.
Hi, first up, I just want to thank you all for the incredible amount of hard work that you've clearly put in to this negotiation process. I do want to just highlight a couple things on the basis of like having attended some of the office hours and the local meetings and like the discussions leading up to this one. I have to say that I do not think the MMB is behaving in a fair way, and do not believe by them promoting essentially measures that do not overall increase the amount of compensation or decrease the overall cost of living in a uniformly effective manner, that behavior on their part to refuse to negotiate on those points should be incentivized. So I'm going to vote no, and I would encourage anybody that considers that to be offensive or not respectful to do the same, in spite of the pieces that our negotiation team were able to guarantee and secure in this tentative agreement. I simply don't think that, the money being spoken for already, given an $18 billion surplus, is excusable, given the necessity of labor in securing that amount of surplus, which is obvious given the efforts that the people of the state of Minnesota have done in the post-quarantine era of state government. So thank you so much. I just want to thank you all again, and have a good day. Bye.
All right, so we are right at 1,300. I do see we have a pretty significant amount of hands raised, but I do want to be mindful of folks' time and thank everybody for coming. If you have remaining questions, please do reach out to myself, to Kristin Kirchoff-Franklin, to President Megan Dayton, or your regional negotiator for more insight, clarity, questions. I think that's it for now. Thanks everybody for coming. We really appreciate you.
Thank you.
Thank you.